The prostate, as an important reproductive gland in men, plays a very significant role in sexual function and sperm production. Paying attention to prostate health is of particular importance because disorders in this organ can have serious effects on men's quality of life and overall health. This gland is located below the bladder and in front of the rectal canal. During ejaculation, the prostate gland reduces the acidity of the seminal fluid and increases its alkalinity to enhance the chances of fertilizing the egg. In this video, we will examine the causes of prostate issues. And since diagnosing prostate problems is not always easy, by understanding the reasons introduced in this video, it is possible to speed up the diagnosis of this condition. Hello. Welcome to the Dr. Khoob YouTube channel. I am Muhammad Zari. I am an instructor in internal diseases and surgery at Shahid Beheshti University of Medical Sciences in Tehran. The first cause is having a family history. Usually, the medical history of family members determines the overall health status and diseases within the family. Some diseases, like prostate issues, are genetic. That's why men who develop prostate disease serve as a warning sign for other men in the family. This doesn't mean that other men in the family will definitely get prostate disease, but rather that their risk of developing it is higher. Through genetic testing, it is possible to predict certain abnormal genetic mutations, such as the likelihood of developing prostate cancer or other cancers. In fact, prostate cancer begins with a mutation in a specific gene. Genetic mutation errors are inherited and passed down from one generation to the next. However, sometimes these mutation errors may occur completely spontaneously in the body. The second cause is diabetes. Diabetes has various complications for men, one of which is putting prostate health at risk. In fact, diabetes is not a direct cause of developing prostate issues. Diabetes negatively affects various factors such as hormones and the nerves in the genital area, which ultimately leads to problems with the prostate gland as well. For example, nerve complications cause issues in regulating the muscles related to urination and the prostate. On the other hand, due to a weakened immune system and changes in the antibiotic environment of the urine, people with diabetes are at a higher risk of developing urinary tract infections and prostate inflammations compared to others. For this reason, men who have diabetes should regularly visit their doctor to check the health of their prostate. The third cause is infection. The presence of inflammation caused by infection in the prostate tissue is called prostatitis, or inflammation of the prostate. Sexually transmitted infections and urinary tract infections are among the factors that put a person at risk for prostatitis. If there is an infection in the prostate area, the doctor can also control prostate disease by prescribing medications such as Tabanex to eliminate the infection and bacteria, along with other drugs. Additionally, in some cases, a biopsy of the prostate tissue in individuals suspected of having cancer or with elevated PSA may also cause these infections. This condition is accompanied by various symptoms, including burning during urination, pain during ejaculation, fever and chills, and pain in the lower area, especially the groin and pelvis. The fourth cause is lack of activity and movement. Lack of activity and movement leads to weight gain. Weight gain is directly associated with an increased risk of prostate problems such as prostate swelling, prostate enlargement, and prostatitis. Physical activity also plays an important role in regulating hormones. Low levels of activity lead to changes in hormone secretion, and these changes can result in complications of prostatitis. Supplements such as Prostafid are prescribed by some doctors to prevent prostate damage. People with prostate conditions can significantly prevent prostate disorders by taking these supplements under a doctor's supervision. The fifth cause is obesity. Obesity itself may be a reason for developing prostate problems. Obesity is associated with benign prostatic hyperplasia, or the enlargement of the prostate in older men. Hyperplasia refers to an increase in cell proliferation, which results in a higher number of cells. Measuring the prostate-specific antigen, known as PSA, in the blood is used as an initial test for the early detection of conditions that may lead to prostate cancer. So when you take a PSA test and its level is high, it means you are at risk of developing prostate cancer. People with benign prostatic enlargement also have elevated PSA levels. However, although obesity causes the prostate to enlarge, it actually lowers the PSA level in the blood, and this decrease is artificial. In other words, your prostate has actually enlarged, but because of obesity, the PSA level in your blood appears lower than normal. Obesity increases blood volume, and the PSA becomes more diluted in this extra volume. For this reason, prostate cancer in obese individuals is detected later using this test. Since the prostate is located beneath the bladder, an enlarged prostate puts pressure on the urethra and causes problems with urination. Some doctors, upon observing this issue, prescribe urinary tract medications alongside prostate medications to prevent the prostate from enlarging further. Each of the causes discussed in this video, genetics, obesity, infection, diabetes, and lack of physical activity, can potentially lead to prostate issues. Maintaining prostate health requires a combination of measures. For example, a healthy diet, regular physical activity, taking care of genital health, and consulting a specialist doctor if necessary. People should be aware of risk factors and preventive measures to maintain their prostate health, and pay special attention to following a healthy lifestyle. For checkups, and especially if you notice any symptoms, particularly if there is a family history of this disease, you must see a specialist doctor. Thank you for staying with me until the end of this video. If you have any questions, leave a comment and I will personally respond. Goodbye.